Hello. Hi, hello. This is the recording that would normally have been done in a Zoom session for Monday night, May 29th. This normally would have been a Zoom session, but not many people showed up, and it's kind of painful to do this as a Zoom session if there aren't a lot of people. So I'm just going to tell you what I would have told you on the Zoom. And specifically, that means I'm going to go through the two sets of diseases for this week and tell you the notable thing about them. Everything else you can figure out. Of course, you should know by the time you take a quiz or an exam, you should know whether each disease is caused by a virus or a bacterium. You should know if it's treatable or preventable by one of the big vaccines like MMR or Tdap or DTaP, because I will tell you if it's treatable by one of those. You should know if it's a Torches pathogen, because I'll tell you if it is. You should know if it's a Category A bioweapon, because I'll tell you if it is. So with that all in mind, make sure you're getting that stuff down. At the very least, bacteria versus virus is going to eliminate half of them for you. Okay, so first disease is sepsis, septic shock. Sepsis is a major cause of death. Sepsis happens when the immune system cannot control an infection in the blood, generally speaking. So it's when there are large quantities of microorganisms in the blood for a long time, and there's a powerful innate immune response to that, and that innate immune response is life-threatening. So sepsis is when the immune system cannot control an infection in the blood. So, the problem here, in addition to the fact that it happens, the problem is that it is not easy to identify, and it doesn't show up the same way for every person or for every pathogen. That's why you'll find at clinics signs that say, know the signs of sepsis, because it's not easy to find and people might miss it. And so you might have the opportunity to notice that your patient is septic and alert someone and save that person's life in that way. So learn the signs of sepsis. Septic shock is the, it's kind of an outcome of sepsis. It's when sepsis has gotten to the point of organ failure and massive decreases in blood pressure that are themselves life-threatening. So that's sepsis. Endocarditis is a infection of heart valves, and there are two forms of it. Acute endocarditis tends to be caused when people get a large amount of pathogenic bacteria in their blood for some reason, and often through things like intravenous drug use. And some of those bacteria, like you can imagine, if you inject Staphylococcus aureus into the bloodstream, it knows how to do bad things to you. And so if you inject a lot of it into the bloodstream faster than the immune system can instantly deal with it, they can colonize a heart valve. And this can be very dangerous. Subacute endocarditis is generally caused by less pathogenic microorganisms, but it happens when a person is predisposed, like if a heart valve has some damage to it and an easy way for bacteria to attach. Then something as simple as dental work can introduce oral bacteria into the bloodstream, and they can attach to the heart valve and cause subacute endocarditis. So that is that as well. That's why people with heart issues might need to take prophylactic antibiotics when they have dental work done. Anthrax is a Category A bioweapon. Anthrax is a spectacular bioweapon because it is an endospore, or it's caused by an endospore-forming bacterium. That means that it's easy to deliver to large quantities of people in a short amount of time. So the thing that public health people worry about is in a bioweapon attack with anthrax. Anthrax would be sprayed over a football arena holding 60,000 people, and all of them would die if they don't get immediate antibiotics. And some of them would die anyway. And so that would be hugely disruptive, as you can imagine, and that's why it's a Category A bioweapon. Compare anthrax to smallpox, and the way smallpox has been used as a bioweapon in the past is by infecting a small number of people and they pass it on to others. Anthrax is not like that. Someone with anthrax generally doesn't give it to someone else. So it would be used in a completely different way from something like smallpox. And so in a way, smallpox is scarier because it would be much easier to start something with smallpox in a way nobody notices. But you're definitely going to notice if an airplane flies over a football field and sprays the crowd with something. And that would be anthrax. Gas gangrene is caused by several different organisms, but the most famous one is Clostridium perfringens, which is a endospore-forming obligate anaerobe that lives in soil. And the idea with this is that in wartime, a bomb would go off in the soil, and bits of soil would get into people, and that alone wouldn't cause blood loss, or it certainly wouldn't be enough to kill someone. But then those endospores are deep enough in the tissues that they can find a place without oxygen, and they can germinate and start growing. And what they do is they cause tissue necrosis, and they do fermentation, and they release gases as waste products, and those gases build up pressure in the tissues that cuts off circulation. So they build up gas pressure that stops blood and lymph from flowing, and that can cause an entire limb to go necrotic. And that can very quickly seed the body with lots of toxins, and there can be an extreme panic response from the immune system. So that's why amputation was such a common thing in the past. The only way to beat gangrene before powerful antibiotics was amputation. And even now, the only way to defeat gangrene when it advances is amputation. Plague. Plague is it's a cluster of diseases caused by a specific bacterium. And plague has been a horrific companion to humanity for about 1,000 years. Plague has several different forms you need to know. For example, you would have heard of bubonic plague, and a bubo is a grossly swollen lymph node. So what happens is if a person gets plague, some of their lymph nodes will swell up and become visible. And that can be very dangerous to them, like not the lymph node, but other things that are happening. And generally, the plague is spread by fleas. So any way a flea can get it from someone who's infected and then get to another person, that's how plague can spread. And you can imagine it's not super fast to spread through a town by fleas. What is super fast is the other version of plague. And that's caused by the same bacteria. What happens is somebody who has bubonic plague, if they're really unlucky, it will attack the lungs and they will cough out large numbers of these bacteria. And someone else who inhales them is doomed because their lungs are immediately infected, and so then they're going to cough out bacteria and they'll die within a few days. Whereas bubonic plague isn't always fatal, but pneumonic plague, the plague that is spread by coughing, this is almost invariably fatal. We can treat this with antibiotics, but that's the thing to know. Learn those two ways plague is spread because they're very different. One of them is very easy to stop and one of them isn't. Another bacterial disease, the last bacterial disease from lecture 12 is spotted fever, or Rocky Mountain spotted fever, and it's caused by a rickettsia. And a rickettsia is an obligate intracellular pathogen. So it's a bacterium that lives inside our cell's cytoplasm. And it moves from endothelial cell to endothelial cell. So the cells that line blood vessels are where it wants to live. So it spreads along blood vessels, and it's very hard for the immune system to fight it. So these things I've talked about so far are all caused by bacteria. Sepsis can be caused by fungi, protists, even some viruses. But often we think about bacteria. That's typically the first thing we would consider if someone has sepsis. But once we get down to number 7, this is caused by a virus. So the infectious mononucleosis is caused by the Epstein-Barr virus. And that is one of the herpes viruses. Epstein-Barr virus is partly famous because so many little kids get it and never know it, but when an adult gets it, they might get this debilitating infectious mononucleosis, which is a disease that leads to a lot of fatigue and severe sore throats for a very long time. And Epstein-Barr virus has a bad reputation for triggering autoimmune diseases. A lot of people can trace back things like narcolepsy, chronic fatigue syndrome, chronic pain to an infection by the Epstein-Barr virus. And having Epstein-Barr virus antibodies, I believe, can predict whether someone will get long COVID after COVID-19. So something very special about the Epstein-Barr virus is terrible for humans. Because generally, it's not going to kill you, but if it causes one of those autoimmune diseases, that will be a horrible, horrible thing. Ebola virus disease, you've probably heard of Ebola hemorrhagic fever. And the thing to know about this is that Ebola virus is able to infect most tissues in the body. It's really spectacular in what it can do. And in some cases, it's a gastrointestinal disease that spreads through feces. And in other cases, it really is a hemorrhagic thing where people lose blood through a lot of their tissues. Ebola is horrible because, well, lots of reasons. One is it does have a high mortality rate, but another is that there's a social stigma in places where there's a lot of Ebola. And a family who realizes one of their members has come down with it might hide that person and try to take care of them at home. And the people at risk are caregivers. And so what that leads to is a whole dead family. Recently, several vaccines have been released for fighting Ebola, and one of them is protective. One of them can be given during an outbreak, and I believe one of them can be given before an outbreak. So the world might be starting to get Ebola under control in our lifetimes. And I should say, I believe Ebola virus was first discovered in 1977 during an outbreak in what was called Zaire, but it probably existed before then. And so there's that. HIV/AIDS. This is a pandemic currently going on. It has been since the mid-1980s. Maybe early 1980s. I don't remember. You need to know what these things stand for. What does HIV stand for? What does AIDS stand for? And what do they do? HIV has something like a 99.9% mortality rate in the absence of treatment. So it is a death sentence unless the person gets modern drugs. And we have modern drugs that can treat HIV and keep the virus at low levels so that the person does not progress in that disease. What HIV does is kill T cells. And you can imagine if you kill your T cells, then you get things like, or specifically CD4 positive T cells. So it kills helper T cells. So that means you lose your cell-mediated immunity. So you can't, or I should say, you lose part of it. You lose macrophage activation and you lose B cell activation. So HIV hollows out the immune system over time, and eventually that becomes AIDS, which is the acquired immunodeficiency syndrome or adaptive immunodeficiency syndrome. Acquired is the old term for adaptive. So the acquired immune system is what you would have learned about 30 years ago. That's why it's called acquired immunodeficiency syndrome. If I named it today, I would call it adaptive immunodeficiency syndrome, but that's not its name. Okay, so what all these diseases had in common from 1 to 9 is they're all kind of internal diseases. Diseases that might spread in blood or lymph, and not really focus on any body system or any organ in particular. The rest of these are diseases of the, these 10 through 13 are diseases of the nervous system, and then 14 and 15 are other diseases. And I'm forgetting why I put them in this order. But bacterial meningitis is life-threatening, and there are 3 different causative agents that make up for most of the cases. So make sure you learn all 3 of them, because you would treat them differently, and you should know their names. And as you can imagine, this is an infection of the meninges. So this is where you have to know which antibiotics can cross into the meninges. Tricky. Tetanus and botulism are both caused by members of the Clostridium, just like gas gangrene. So that means they're both obligate anaerobes who form endospores. So these are caused by bacteria that form endospores and grow without oxygen. And so in both cases, somebody who has these diseases isn't going to spread them to anyone else. These are just killing a person from the inside, and you've seen these both because in both cases, they work by releasing one toxin, and that one toxin paralyzes the immune system, paralyzes the nervous system. So a person will die when their diaphragm can't contract or relax like it needs to do every few seconds for breathing. So tetanus leads to what used to be called spastic paralysis, where a person cannot relax their skeletal muscles. And botulism causes flaccid paralysis, where a person cannot contract their muscles. Either way, the end result is the same, where a person can die from that paralysis. Botulism is caused by that botulism toxin that the bacteria release, and that is supposedly the most potent toxin known. So that's something. The last disease of the nervous system I want to talk about is rabies, and rabies has an odd distinction, which is that it is often called the disease with the highest mortality rate, which is really saying something, because diseases like pneumonic plague exist that we say has roughly 100% mortality rate, but rabies has a roughly 100% mortality rate, and if you looked at those percentages, the rabies percentage would be like 99.99999% of people who get rabies die from it. But there's another weird thing about rabies. It doesn't just do horrible things to people and then kill them, and because it definitely does that, but also up until the point where a person starts getting signs of rabies, it's completely preventable. So a person who gets bitten by a rabid dog won't get rabies if they get the vaccines and the antitoxins. But if they wait to get the vaccines and antitoxins until they start getting rabies signs, then they're almost certainly going to die. So it's a very strange thing, because a person who gets exposed to the virus can be protected. Almost 100% chance that we can save them until the signs of the virus appear. And after that, there's a very, very small chance of saving them. The thing about rabies is I believe in 2003 in Milwaukee, Wisconsin, some clinicians figured out a way to save someone who had symptoms of rabies. And that involved putting them in a coma for weeks and basically trying to keep their brain activity very, very low until their immune system mounted a strong response. And then they slowly let them wake up again. And that person was in the hospital for over 2 months, and they had to relearn how to walk and talk. But eventually that person went to college, had a family, lots of things. So it made a essentially full recovery, or full enough. But that same technique has been attempted with other people who have rabies, and it only works in something like 10 to 20% of cases. So if someone has rabies signs, the best medical care gives them something like a 10 to 20% chance of survival. So rabies is really horrible. All these other things we can generally treat, but not so much rabies, not so much rabies. Rabies is horrible. The main sign of rabies is hydrophobia, where a person or animal becomes afraid of swallowing water, because when they imagine swallowing water, their pharyngeal muscles contract involuntarily in a way that is painful. That's what the virus does to them. For somehow, the rabies virus connects the idea of swallowing water to powerful spasms of the pharyngeal muscles. So a person with rabies struggles to drink water. A dog with rabies will not swallow its own saliva, so it foams at the mouth. And since the rabies virus gets released by the salivary glands, a dog that is a little bit disoriented and foaming at the mouth and biting people is giving them rabies. So rabies is something you should know. Rabies kills 50,000 people around the world every year, and almost all cases are in places that don't mandate dog rabies vaccinations. If we lifted that requirement and didn't force people to vaccinate dogs against rabies, we would hear about rabies, because dogs all around the world are the biggest risk for spreading rabies. So we're lucky in that our dogs don't give us rabies. Malaria is one of the biggest infectious diseases in the world, one of the biggest priorities for public health, because some strains of it do cause fatalities. And there are so many cases of malaria that together they end up causing a lot of fatalities, especially among children. So malaria is just a terrible thing, and it's caused by a protist that has a very fascinating life cycle that requires both a mosquito and a human. All right, and then the last thing in Lecture 12. The last disease in Lecture 12, notable aspects-wise, is Cytomegalovirus. This is another herpes family virus, Cytomegalovirus. People who get this virus generally don't realize it's anything special. And that's a problem because it can cross the placenta and infect a fetus. So this is the C in torches. Also, people who have AIDS, so their HIV has not been controlled, this is one of the most common killers of people who have really depleted immune systems. So people who have AIDS will get cytomegalovirus infections routinely, and they must be dealt with. So that's Lecture 12. That's Lecture 12. Lecture 12 is, I don't know, a lot of horrible things to think about. So let's think about Lecture 13. Lecture 13 has 14 diseases in it, and the next should be lecture 14. The next lecture has 16 to make up for it, to make sure you get that even number. So let's go through it. What are we looking at? We're looking at respiratory diseases like streptococcal pharyngitis. Well, this is strep throat. This is that painful sore throat people can get, where they can have so much pain in the throat that they cannot swallow the painkillers that they get sent home with. So, truly horrible. This is caused by Streptococcus pyogenes, and you know it can cause other diseases, and often it does. So strep throat, part of the reason why we're willing to treat it with antibiotics is to prevent the other diseases the bacteria can cause once they've been in the body for a while, like scarlet fever, for example, or rheumatic fever that attacks the heart and the joints. Scarlet fever used to be a scourge of childhood. It used to terrify people and kill a lot of kids. It doesn't really do that anymore, and it's not clear why. Because the decrease in scarlet fever incidence happened long before antibiotics were invented. So nobody knows exactly why scarlet fever doesn't kill lots of kids anymore. Now it would be treatable with the same antibiotics that we would use to treat strep throat. And so we can be lucky. We can be grateful for that. Diphtheria and pertussis are the D and the P from DTaP and Tdap and DPT. The T is tetanus, which was in the last lecture slides. Diphtheria is a disease caused by a bacterium, and it causes swelling in the pharynx that can ultimately block off the trachea, especially in children who have narrow airways. That's the main concern with diphtheria, and so it was a cause of childhood mortality, and it is currently preventable using that Tdap and DTaP vaccines. Pertussis is a little bit different. It is not super well controlled. So pertussis still does happen. People get pertussis. It's called the whooping cough. And what happens with pertussis is that people will cough and cough and cough. They'll have what's called paroxysms, where they will cough until they must inhale. And they can't control how they inhale. So they'll cough, 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 and then they'll whoop as they inhale air involuntarily. That coughing fit can lead to things like broken ribs, vomiting, and incontinence in healthy adults. So pertussis is terrifying. Generally, it doesn't threaten an adult's life, but it does threaten small children. So pertussis, it isn't a tortious pathogen because it isn't necessarily passed from the mother to the child, but it can certainly be passed from older siblings to a child. And that's why public health people are aggressive about pushing Tdap and DTaP. They want all the kids to be vaccinated so that they won't pass it to their baby brother or baby sister. And I skipped over the common cold. You know what that is because you've had it. It is the most common infectious disease. It's caused by 150 different viruses, most from 3 different families: the rhinoviruses, the coronaviruses, and the adenoviruses. What that should tell you is that the signs of the common cold have nothing to do with which virus causes it, and everything to do with the immune response we get to a virus infecting the upper airways. So any virus that infects upper respiratory tract epithelial cells will cause the common cold. Tuberculosis is a bacterial disease that kills lots of people. It is the leading cause of death from infectious disease. period. So around the world, more people die of tuberculosis than any other disease. The only time that hasn't been true is, I believe, in 2020 and 2021, COVID-19 killed more people than tuberculosis. But in 2022 and 2023, tuberculosis has gone back to killing more people than COVID. So tuberculosis is terrible. Something like a quarter to a third of people in the world have latent tuberculosis. That is, they have those bacteria hiding in their bodies. And so one thing you're going to have to look at in the slides is the different forms of tuberculosis. Primary infection, primary active disease, latent infection, and secondary disease. You might have heard of tuberculosis as the consumption. That's what it used to be called. And that's the secondary active disease because it causes weight loss and kind of random parts of the body get attacked. Bones could get attacked, for example, even though it's mostly a respiratory disease. And so it would cause weight loss, very similar to what someone might experience with cancers. And that weight loss led to it being called the consumption. So that's tuberculosis. Pneumococcal pneumonia is caused by Streptococcus pneumoniae, and it is the most common cause of, I believe it's the most common serious cause of pneumonia in adults. And it often is what kills someone who had influenza. Often they'll have influenza, the virus gives them influenza, and that predisposes them to pneumonia, and that pneumonia kills them. That is the common way that older people die of pneumonia. They get influenza, and then they get a deadly case of this pneumonia. And there is a vaccine for it, and it can be treated with antibiotics. Atypical pneumonias are really any other pneumonias, but one of them, the walking pneumonia, is caused by a strange bacterium, and it's caused by a strange bacterium that doesn't have a cell wall, so it's called a mycoplasma. So it's a bacterium that people thought was fungus, but it's actually bacteria, mycoplasma. It's really a weird thing, but if you've heard of walking pneumonia, it's caused that because a person can walk into a clinic to get help, as opposed to pneumococcal pneumonia, primary pneumonia, where a person generally is lying down, being very sick. Legionnaires' disease is another kind of strange pneumonia caused by bacterium that is really weird. The bacterium that causes Legionnaires' disease lives in protists. Specifically, it lives in protists that like to live in fresh water. And for that reason, water handling systems in big buildings are a risk factor now. So I don't really know the details of it, but I know the very first known cases of Legionnaires' disease. They're called this because there was an outbreak at a meeting of the American Legion in Michigan in the 90s, and I think it was in the 90s. For whatever reason, a bunch of the protists were living in a hotel's like cooling system, where they have a big water tank. And that was being spread through the air, through the hospital, through the hotel. And so people were inhaling it and getting this disease. Whenever a building shuts down, like a water heating system, there's going to be water trapped in some places, and it will be stagnant, and it will not be hot. And that heat is what normally protects us from the bacterium that cause Legionnaires' disease. So, for example, during COVID lockdowns, places like Lane Community College shut off the heat to their buildings, and that left some of their normally hot water tanks cold. And the bacteria that cause Legionnaires disease did grow in some of the buildings on LCC's campus. And so if this wasn't a well-known thing, we would have come back to campus and we would have been inhaling these bacteria. But it is a well-known thing. And so though everybody knew we had to test the water systems for this bacteria. And before we came back to campus, we were able to treat the water and get rid of the bacteria. So that's something. Respiratory syncytial virus causes a disease that is like the common cold for adults, but like a very serious kind of viral pneumonia or bronchiolitis for children. So this is one of the most common reasons that small children, like under 1, have to go to the emergency room. Another is influenza. Influenza is the #1 virus. It is the enemy of humanity. It's the virus that will kill us all someday. Influenza viruses, there are a bunch of them and they mutate. Some of them have extraordinarily high fatality rates. Most of them don't. But the nightmare scenario, and no one can predict when it's going to happen, no one can reassure us that it won't happen tomorrow, and it's been a nightmare for 20 years, is that bird flu strain will mutate in a way that allows it to jump from person to person. And if that happens, some of those bird flu strains, when they randomly end up in a human, they end up killing the person. Some of those strains have something like a 50% mortality rate. And if they could go from person to person like normal influenza does, that would be a nightmare. So that's why public health people pay attention to avian influenza or bird flu. People who raise chickens or ducks or turkeys on farms absolutely have to pay attention to it, because one thing is it'll kill a bunch of their birds pretty quickly, and another thing is if it's found on their farm, they have to kill all the birds to keep it from spreading, which is its own problem. Influenza typically spreads in U.S. cities in the winter, and people who typically end up being hospitalized are young children and older people. That's during a normal winter outbreak of influenza. But when there's an antigenic shift and there's a brand new influenza strain, that's when the pandemics happen. And pandemics typically flip that whole hospital thing, because a brand new influenza strain will generally trigger an overactive immune response in healthy adults. And the stronger the person is, the stronger that immune response is, and that immune response is what kills them. So during pandemics, like the 2009 pandemic, and certainly the 1918 pandemic, people who were likely to be killed by influenza were 20-year-old men and women. And so during a pandemic, the people going to the hospital will not be the youngest and the oldest. They will be the healthiest young people. So influenza sucks, and the bird flu is the highly pathogenic avian influenza. The last two here, I want you to go through the slides and read about them. I'll just say SARS is caused by a coronavirus, and it is it was terrifying. It caused a pandemic very briefly, but through contact tracing and quarantining, public health authorities around the world were able to stop the spread of SARS. And so if you think back to the beginning of the SARS-CoV-2 outbreak, COVID-19, you might remember attempts at contact tracing and quarantining. That all happened because of our experience with SARS. It didn't work with COVID-19, and there's a good reason for that, but it did work with SARS, and here's why. SARS caused people to get very sick, and they were most infectious when they were very sick. And people who had SARS would know it, and everyone around them would know it. And the people most at risk at getting SARS were people who, healthcare workers in respiratory care. There's a hospital in Hong Kong where something like half of the nurses in a unit died of SARS. Compare that to COVID-19, where people who don't have any symptoms at all can still spread the virus. Well, what that means is you can't stop someone from spreading the virus. You cannot contain COVID-19 without shutting down an entire city. And so back when COVID-19 was spreading super fast, the only way to protect us and to keep hospitals from being flooded with numbers of patients they couldn't dream of treating, the only way to stop that was to shut down cities. And then once the vaccines were out, we had better tools, and with masking, we had better tools. But the only tool we really had in March of 2020 was shutting down cities. That's the only way you can stop COVID-19 from spreading. So COVID-19 is still spreading. It is still infecting, the virus is still infecting people and killing people. But hopefully it won't cause any more societal disruption the way it did in 2020 and 2021. Well, that's the respiratory diseases. There's a lot more information about them for your flashcards. What I hope to give you in this 40-minute video, this super long video, is just the notable aspects. This is what I would have gone through on a Zoom, but this is faster than it would have been on the Zoom. So now you know. Good luck. I'll see you in class.